tuning into the Ombudsman program. My name is Rachel Barnett. I'm an assistant ombudsman at the Ombudsman office, and tonight's program, entitled Navigating the Health Insurance Marketplace, will be about learning about the health insurance marketplace from the Affordable Care Act. And I am delighted to welcome three guests that will provide us valuable resources and information on this topic. My guests today include Diane Cummins, Program Manager of the Samaritan Homeless Clinic, Asia Troutman, Certified Navigator at Helping Hands, and Aaron Morman, Certified Application Counselor for Community Health Centers of Greater Dayton. Thank you all for being here today.
Yeah, pleasure.
Great, thanks. So I think we're going to get started just by talking a little bit about the health insurance marketplace and find out who is eligible to use it. So Diane Cummins, let's start with you. What exactly is the health insurance marketplace?
The health insurance marketplace is essentially what it says. It's a marketplace. It's a place that individuals can go to buy health insurance. Now, it's something, we've always been able to go out and buy health insurance on our own, but this is something that puts together different plans for comparison, kind of like Amazon. Yes. You know how it compares different kinds of things when you say, oh, I want to look at these three items? Mm-hmm. It compares that, but it also puts into the equation what your tax credits might be, mm-hmm. To reduce your premiums. So it is a way for folks to know what actually their out-of-pocket expense is going to be when they buy insurance.
Great. Yeah. Asia or Aaron, do you want to add anything to the basic description, or anything you think our viewers should know?
Well, anybody can shop at the marketplace. It doesn't matter what your income is or this or that. Anybody can shop there. In order to the big thing that the marketplace does is offer subsidies in order to help you pay for the health insurance. So in order to be eligible for those subsidies, though, your income has to be between 100% and 400% of the federal poverty level. In that range, you're looking at the advanced premium tax credit, which helps with your premium payments. In addition to that, there's also subsidies to help with your co-pays and co-insurance and your deductibles. In order to be eligible for that, though, you have to be between 100% and 250% of the federal poverty level.
Okay. Asia, I think Aaron's talked a little bit about some of the people who are eligible for the health insurance marketplace. Are there any kind of basic criteria for people who aren't eligible?
The basic criteria for the ones that aren't eligible, if you're already on the Medicaid or Medicare already. Okay. Also, individuals that currently have health insurance through their job that is affordable for them.
Okay, they couldn't shop. Mm-hmm. Okay. Do we know how many people, and Diane, jump in if you'd like, how many people in the Montgomery County area that we anticipate are going to be shopping at the health insurance marketplace?
Well, we estimate that there are approximately 535,000 folks in Montgomery County that don't have health insurance. Okay. Now, all of those folks won't be shopping on the marketplace. Many of them, about I think 16%, are going to be eligible for Medicaid. They fall under 100% of the FPL, or federal poverty guidelines, so they're not eligible. But there's still a good number of folks who are eligible and could be shopping. I think we're thinking probably less than 200 will take advantage of it, 200,000 this go round, remembering that we're going to have open enrollment again in another year.
Okay, okay. And Asia, I know your market's a little bit larger. You include other counties as well. And mm-hmm. So do you have other information that you'd like to share about how many people you plan to reach?
The largest counties that we're reaching out to are Montgomery County and Clark, mm-hmm. and the people that we're reaching out to would be possibly about 131,000, and which is 70% of those individuals are in Montgomery County.
Okay. And then Aaron, is your outreach in Montgomery County, or do you serve other populations as well?
We do a number of things. Our first target goal is we handle 6 community health centers here in the Dayton area. So we're first reaching out to them, but we also are reaching out to surrounding counties. We got the Community Health Centers of Dayton as a federally qualified health center. and all the health centers throughout the country got offered a grant to hire folks to do this education and enrollment. There are some counties around Montgomery County that do not have an FQHC, like Miami County and Greene County and Preble County. So we've been reaching out to those counties as well to assist their folks.
Okay, great. And Diane, I forgot to ask you, is the Samaritan Homeless Clinic, are you working mostly with Montgomery County residents, or?
Right now, we're putting our focus in Montgomery County, but we have done a little bit outreach to the other counties. What we've done, because the homeless clinic largely serves folks who are under that ability to use the marketplace effectively, they basically have no income or have very low income. But because we were in FQHC, we also received the grant. So what we have done is we've partnered with Five Rivers Health Centers, which is another FQHC system here in Montgomery County. Actually just became an official FQHC last Thursday. They were a look-alike. And they have 4 centers as well. So we're working with their centers and sending our folks out there.
Real quick, I don't know if we've been using the word FQAC, but I don't know if anyone defined it. So would you like to say what that is?
An FQHC is a federally qualified health center.
Okay.
It's usually a community health center designed to treat or to meet the healthcare needs of the underinsured and uninsured.
Okay.
Although anyone can go there. Our particular federally qualified health center of the 3 that are here in Montgomery County is a special population, so we can only serve the homeless.
Okay.
But the Aaron's is open to the community, as is Five Rivers.
Okay. So Aaron, I have a question for you. If a person's not eligible to take part in the health insurance marketplace, are they still required to have insurance?
No.
Okay.
Yeah, simple answer is no. The marketplace is going to serve those folks who do have some income. What we were missing out on here in Ohio for initially was the expanded Medicaid. Hopefully everybody's kind of aware that that got through the controlling board recently. So those folks are going to qualify for the expanded Medicaid now for the most part. But basically, if you do not qualify for the health, for the marketplace, or you don't have your own, or if you're above that 400% and you don't have your own, or you're on Medicare, Medicaid, etc., then no, you're not required to do anything, and you're not going to be assessed the fine for not doing so.
Okay. Do you want to talk a little bit about just kind of basically the Medicaid expansion, since you've mentioned it? For our viewers who may not be familiar.
Sure. Originally, when the Affordable Care Act was set up, it was kind of set up as a gradated stepping up. You know, the states were going to expand Medicaid, so the folks that were below 138% were going to qualify for Medicaid. Above that 138 threshold, you were going to have the marketplace. Over 400%, the government assumes that you can afford your own health insurance at that point. Initially, while they went to the Supreme Court, it was decided that the courts did not have to do that. It was an option. Ohio initially did not expand Medicaid, so we still had this big gap of folks between 0 and 100% who did not qualify for anything. Well, it did pass the controlling board, so we do have expanded Medicaid here in Ohio now. It'll be effective January 1st. So those folks will now qualify for that portion of Medicaid.
Okay. Is there anything that either of you would like to add about the Medicaid expansion?
The one thing I find myself having to explain to a lot of people is that there's an assumption that if you're poor, you've always had Medicaid. And that's an inaccurate assumption. If you are a single adult with no dependent children and no disability, you've not been eligible for Medicaid. So these folks have been uninsured for a number of years. And I think that when folks talk about, oh, well, they already had Medicaid. No, they didn't.
Right.
So I think that was the biggest thing, that's going to be such a help for that group of people.
The single adults without dependents, yeah.
And the big thing, we don't know yet, you know, it's going to be effective January 1st. We haven't been told yet when we're going to be able to start doing the applications for that. We're kind of guessing in December, if not before, but we've been kind of telling people, call us back in December, or we'll call you back in December, and we should know at least when we'll be able to at that point.
Okay. So it sounds like then you guys will be helping with Medicaid, is that right, Asia?
Yes.
Yes.
Yeah.
Mhm.
Okay. So will all of your agencies be helping with Medicaid applications?
Yes.
Yeah.
Great,
That's
Yeah.
wonderful.
It'll be part of the marketplace as well. When you do Medicaid, the application for the marketplace, it's going to determine the eligibility for the Medicaid as well.
Okay.
And Ohio will have actually a separate Medicaid site as well, in
That's what I
addition
was-
to the marketplace.
Okay, so you will help with the application to Ohio Department of Job and Family Services and make sure that, okay, great, wonderful. Well, let's talk a little bit more specifically, and Asia, I'm going to direct this to you.
Okay.
What are the requirements for individuals and families in regards to healthcare coverage? Are there different requirements as to what a person gets based on maybe their age or their medical condition, or is there anything that you could kind of talk about that?
Yes, as far as their age goes, as far as their dependents, they can put their children on their insurance
Okay.
as well, as long as they're up to the age of 26.
Okay.
And if they're over the age of 26, they'll have to purchase their own insurance at that time.
Okay.
And any children that you claim on your taxes, you can put them on your insurance as well.
Okay. What about families that share custody or shared parenting? How does that work?
It just depends on what the court document states and who
Okay.
is supposed to carry the insurance for that child. So it all depends on
I
the
see.
type of court documents they
Okay.
have.
That makes sense. So really the only requirement is your age,
Yes.
for example. Okay. And I think you mentioned before that if you were on Medicare or receiving Medicaid, then you wouldn't be able to shop either. Okay. Erin, will you be helping, well, I guess we kind of talked about that you guys would be helping with the Medicaid application process, but
Right.
as of right now, you're not. Is that correct? That's going to happen in December?
For the expanded, the marketplace still currently does look at the current Medicaid standards and can determine the eligibility for that. So yes, we can at this point.
Okay.
It's just going to be expanded and changed a little bit when that expansion becomes effective.
Okay. And then Diane, if someone comes to your agency that maybe you find they're not eligible for obtaining insurance through the marketplace, do you, or I'll open this up to you guys after, do you have resources that you can provide to them, or do you try and help them find medical coverage in some other way?
Yeah, we treat them just like we do if they come to us for any other service.
Okay.
If we aren't able to help them under the rules of our own setting, we'll hook them up with another community health center, like community health centers of Greater Dayton or Five Rivers.
Okay.
An unmet need in this area is dental, so we'll try to hook them up with some type of dental care. So we try to link them to whatever services that they can get if they can't get them where we're offering them.
Okay. Asia, would you like to add anything, or Erin, about what you guys do?
With Helping Hands ComCare, we're not a health agency
Okay.
as far as being able to treat individuals or anything like that. But Helping Hands ComCare is a division of Helping Hands Community Outreach Center.
Okay.
And if individuals need insurance such as dental or vision, we have different programs within Helping Hands Community Outreach Center where we can direct them to different individuals that will be able to help them get the insurance that they need. And also if they have any questions with filling out any of the Medicaid or Medicare forms as well.
That's wonderful. Anything?
And ditto, basically.
Okay.
You know, if they are other, as you talk to them, you inevitably find out that they need food stamps or they need clothing or this or that. And we've got a large database of community resources that we can connect them with.
Wonderful, great. So I don't know that if we've touched on this yet, but Erin, I'll just ask you, what happens if individuals who are required to get insurance don't get it in time?
Okay. Well, they could possibly be looking at a fine.
Okay.
For this first year, it's $95 per adult in the household and $47.50 per child, or 1% of the total household income, whichever is higher. It's going to go up to 2.5% next year, and it'll keep increasing over the next couple of years.
Okay. And are there any exemptions or waivers to those penalties, or?
There are a number of different waivers. There's some religious groups, If you, again, if you don't qualify, if you don't even make enough to like be required to file taxes, things
Okay.
like that will exempt you as well.
Okay. Well, let's talk a little bit more in depth about the services that you guys do provide. So, Asia, you're the certified navigator here. So why don't you tell us what a certified navigator is?
Well, we help individuals on either a one-on-one basis or in a group setting, and we can sit down with the individual and they can ask us questions about their certain things that may be going on with them that we would be able to answer, and also which insurances could possibly be good for them as well. And we can also help them fill out the applications as well as on a one-on-one basis.
Okay. And Diane, what are certified application counselors?
Certified application counselors are folks who have gone through a fairly rigorous training and certification test, not quite to the level of a navigator, where a navigator can actually give them advice on what insurance is best for them or what might be a better fit. The CACs are really educated helpers. They're going to answer their questions, educate them, guide them, but in the end, it's the individual would have to make their own choice. So, you know, they're essentially doing a lot of the same things, but not quite to the degree the navigators do.
Okay. And Erin, would you like to add anything about the role of a certified application counselor?
No, I think she covered it pretty
You did a
good.
great job.
The big thing is we can't recommend a plan, and the navigators can. That's one of the big differences.
Okay. Are there any other differences, or?
Well, I know as a navigator, we had 26 exams that we needed to take,
Oh, wow.
which was very extensive
Yeah.
as far as the training goes.
Okay. So much more extensive training.
I think you have to be a licensed insurance agent as well, right?
Yes.
Where most of our folks are just social work type folks.
Okay.
More folks that have been in the social services arena, have been helping folks with other kinds of healthcare needs, and now know how to do this as an extension of their job.
Okay. And you did speak to the more rigorous training. How long of a process is that to become a certified navigator?
If you worked on it every day, it would generally take you about a month
Okay.
to complete the certification through the marketplace. But then at the same time, you have to go through the Ohio Department of Insurance to determine your eligibility through the insurance as well.
Okay. So you are a sort of like an insurance specialist at this point.
Yes.
Okay. Great. So, since you're the specialist, how does the insurance marketplace work? Do you want to maybe give us kind of a broad overview of maybe what kind of happens during an application process?
Well, the individuals, I'm going to go based off of the individuals that come into our facility.
Okay.
We'll have them view a presentation of how the insurance process would go. At that point, if they have any questions, we'll answer any questions for them at that time. And we would get on to the marketplace, which is www.healthcare.gov. And at that point, they would fill in all their information, Social Security, birth date, any wage information. And at that point, once we get through that whole process, they're able to see the different plans that would be out there for them, and it breaks it down into bronze, silver, gold, and platinum. And they can decide which is more affordable for them at that point.
Okay. And Erin, can you speak a little bit about how the qualified health plans are established in the marketplace? Are there basic criteria that they all have to meet? And if so, what?
Yeah, a couple of the big things that they're required to do is they have to offer a standard bucket full of benefits
Okay.
that each of the plans have to offer, and it's pretty extensive. It kind of runs the lines of Medicaid, but even a little more comprehensive. So you've got your office visits and hospitalization and paternity and mental health, et cetera, et cetera, et cetera. So they all have to offer those. They all have to offer a silver and a gold level plan in the marketplace, and she touched on that a little bit. And at the minimum, they can offer everything from a catastrophic up to a platinum, though. Additionally, whatever they offer through the marketplace, they also have to offer to the general public as well outside of the marketplace.
Okay. Now, we did mention that there's a difference in maybe the age composition and what you have to get, but is what is the required level? Is that the bronze level?
Well, I guess the starting out is the catastrophic, and these are for the young folks that are 30 and under. And these are the young, healthy folks who don't go to the doctor very often. So this catastrophic is just kind of there for them if they're in the hospital or this or that. Your premiums are going to be the least.
Sorry.
Then I'll go up from there. The bronze is your next level up, where again your premiums are going to be fairly small, but your out of pocket is going to be a lot more.
Okay.
It's basically a 60-40 split, where the company is going to pay for about 60% of the expenses, and you'll be required to pay 40%. And that'll go up to a platinum, which is basically a 90-10 split.
Okay. And Diane, do you know the insurance companies that are providing insurance in the marketplace?
Each county and each region has different groups, and it depends when the insurance company applied to be a QHP, where they applied.
What's a QHP?
Qualified Health Plan. I'm
Okay.
sorry.
No, you're fine.
But when they applied, they had to identify what areas they were going to put services in.
Okay.
In this area in Montgomery County, I know we have Anthem, Buckeye, CareSource, HealthSpan, Medical Mutual, Molina, and a few others. So,
Okay, so-
there's a dozen or so. Am I counting it right? I'm not
There's
counting.
12 different.
12 different in this area.
Okay, so pretty extensive list.
And then each of those have the different bronze, silver, platinum within that plan.
Okay. Now, Asia, I wanted to ask you this because I know that you guys get into kind of helping people with the selection of plans. And so I think one of the things that individuals might be concerned about is, you know, well, can I still have my same doctor if I pick one of these insurance plans? Do you have any thoughts or advice on how a person could figure that out maybe during their appointment?
When you go through the marketplace, it does give you an option that that will allow you to see if your doctor accepts that type of insurance.
Okay.
But I always tell clients, just to be sure, contact your physician and ask them, you know, do you accept this type of insurance?
Okay. Now, Erin, how do individuals and families, how do they compare the health insurance plans in the marketplace?
As they go through the application process, that's kind of the last thing that's going to pop up for them. You know, you've entered, you know, where you live and whatnot, and that's going to determine, you know, what plans are available. So the marketplace, as they go through the application, is going to show them that. Then they'll be able to do a number of different things to compare plans. You know, especially you can plug in the doctor that you're looking for or a particular prescription, and it's going to pop up with these plans that are eligible. And at that point, you're going to know what type of subsidies that you can qualify for. So you'll be able to plug those in as you're comparing those plans as well to see what your out-of-pocket costs are going to be.
Okay. And so when you're working with individuals who bring in their information, are you able to help them select plans based on, you know, oh, I have these prescriptions and I see these doctors?
Yeah.
Okay.
Right, yeah.
Wonderful. Asia, would you like to talk about how the subsidies work in the marketplace?
Yeah, sure.
Okay.
Well, the subsidies, when you go through the marketplace, it will tell you if you're eligible for the subsidies or the premium tax credit.
Okay.
It will let you know, and at that point, it gives you the option if you want to use all of your tax credit to help cut your monthly costs down, or
Okay.
you can use part. And
Okay.
which, if you use part, it will use half of your premium tax credit towards the your monthly amount that you would pay each month, or you could use none of it, which you would have to pay that full amount of the insurance. But whatever money that you didn't use for the premium tax credit, you'll get that back at the end of the year.
Wonderful. Does it have to be full, half, or none, or are there gradations in the middle?
They give you 3 choices, and those
Okay.
are your 3 choices.
Okay. Diane, if I have currently a qualified health plan, can I shop in the insurance marketplace, and should I think about it?
The first answer is yes, you can.
Okay.
Anyone can.
Okay.
Would there be a benefit to you? Maybe not. If you are currently covered under a qualified health plan through your employer, first of all, it's unlikely that you're going to get a better deal in the marketplace because your employer is probably picking up part of that premium already. And if your employer is offering a health plan that is considered affordable, then you are not eligible for the tax credits through the marketplace. So you kind of get hit twice. One is that your employer's portion isn't there, and then you're also not getting the tax credit. Now, if you're a person who is buying your insurance on your own already, you certainly should go to the marketplace and see what's out there and do some comparison shopping. You don't have to change, but you would know what was out there a little easier.
Sure. Yeah, that makes a lot of sense. Erin, what if a person or a dependent in their family, what if they have a pre-existing health condition? Is that a concern in the marketplace?
No, that was one of the things that was brought about by the Affordable Care Act, that insurance companies can no longer discriminate against people who have a pre-existing condition.
That's wonderful. Asia, sorry. Asia, I wanted to ask you, we do have a lot of immigrants here in Dayton and Montgomery County. Is there anything that immigrant families need to know about their eligibility in the marketplace?
As long as you are a U.S. citizen, or if you have a green card or an alien card, you are eligible to apply for the marketplace as well. And if your children are considered U.S. citizens or also have a green card, but if you do have a green card or even a tourist card, you can apply for the insurance, but you have to stay here for the whole portion of the time that you are enrolled through the marketplace.
Okay. Is there anything that either of you would like to add about it? No? Okay. I kind of want to go through a couple more possible scenarios, just because I'm thinking some of our viewers might be out there wondering if, these are concerns that they should have. So, Erin, what if a person's unemployed? Can they still use the health insurance marketplace?
Yes, they can. It's going to depend on how, one, they're unemployed. Were they laid off? Are they receiving unemployment benefits? Because again, you're going to need some sort of income in order to pay your portion of the cost through the marketplace. Even if they don't have any income, though, they could still do their application through the marketplace and probably qualify for the expanded Medicaid.
Okay. What if, Asia, a person's working part-time and they're not receiving health care benefits through their current employer? Would this be a candidate for the health insurance marketplace?
Yes, it would, because they don't have current health insurance through their job, and it may not even be affordable through their job as well. So I would definitely encourage them to apply through the marketplace.
Okay. And Diane, what about if someone is currently receiving COBRA or does have a health care plan?
COBRA is a great example of someone who should probably look at the marketplace. Historically, COBRA has been relatively expensive and is intended to be a short-term fix for a gap in employment service. And if the person does not have another job lined up, or if they don't have a job that's going to be leading them to an insurance plan, definitely they're a good candidate for the marketplace.
They should look. Okay. Let's kind of go through each agency, and I'll start with you, Erin, and just say how, if somebody wanted to get assistance from community health centers, how would they go about doing that?
The easiest thing is just give us a call.
Okay.
The number is 586-9733. My extension is 1035, and my partner Stacey's extension is 1034. We have 6 centers, so we kind of try to steer the folks that are closer to whichever center. For example, I handle Drew Health Center, which is on West 3rd, Alex Central, which is in Miamisburg, and Southview, which is in Kettering. Stacia handles East Dayton Health Center, Cassano, and Corwin next Dayton, which is on Stanley. So if they call us, we can certainly set up an appointment for them at whichever center is closest to where they live.
Okay, and there's just 2 of you?
That's correct.
Okay. And it's best to call?
Yeah, that's.
Or they could come into one of the clinics?
Yeah, they if they want to come in, what they will do is, because we're out and about, we're not always, we may not be there when they're there. The front staff will give them a little blue card to fill out with their information, and we'll give them a call back to set up an appointment.
Okay. We're going to stop for just a second because I think that we have a caller. So, caller, go ahead and go through with your question. Are you there? Caller, are you there?
Hello, yes.
Hi.
Now, this is a wonderful show, and I've learned a lot.
Thank you.
My question is this. At my church, there is a program that tries to help people who have lost important documents related to their identity. And do the Navigators, and I've heard about the Navigators who help people, guide people through getting health care. Do they know how to deal with people, sometimes older people who don't have or have lost the documents that might be necessary to establish their identity? Thank you, and I'll take my answer off the phone.
Thanks, caller. That's actually a really great question. Asia, would you like to start as a certified navigator?
Well, as when you're filling out your information on the marketplace, it's definitely going to ask you your social security number, as well as the social security numbers of individuals in your household, as well as their birth date. And let's say that you don't know your social security number. At that point, it will direct you to Union, Kentucky at that point, and then they can help you navigate through the process of making sure that your identity is correct. And as well, and they can help you through the marketplace as well.
Okay. So am I understanding you don't have to have your social security card, but you do have to know the number?
Right. You don't have to have
Okay.
your card with you,
Okay.
but you do need to know the numbers.
Okay. Now, through the certification process, will you have to provide those documents, a social security card or like a state ID or anything like that?
No, unless the marketplace kicks your application back and asks for that information, then you'll have to supply that information
Okay,
at that
great.
point in time.
I think we do have another call, so we're going to pause for another call. Caller? Hello, you're on the air.
Yes, I wanted to ask about the people who fall in the cracks, the people who are not covered by the Affordable Care Act, but above, I'm not sure what the guidelines are. Could you please talk a little bit about that?
Sure. Thanks, caller. Aaron, would you like to take it?
Yeah, luckily with the expanded Medicaid, that's really taken care of a lot of those folks because from 0 to 138% of the federal poverty level, they're going to qualify for Medicaid now. Then from the 100 to 400%, they'll qualify for some subsidies through the marketplace. So just about everybody is covered now, especially with that expanded Medicaid.
Okay. I also kind of wanted to get back to the first question and just see, we'd heard a navigator perspective. So Diane, if a person came to your agency and had difficulties with those documents, do you also provide any assistance if they do end up having to turn them in, for example?
That's actually a real common problem in the homeless population.
Yeah.
So we have, in addition to our certified application counselors, we have social workers on staff who will work with the individual to help them get their ID, often working with churches such as the first caller mentioned, to help fund that if we need help getting funding for that.
Okay.
So yes, we do.
Okay, great. And then, Aaron, you had mentioned the people that fall through the cracks, and with the expanded Medicaid, that will certainly be reduced significantly. I do still think that there will be some people that'll fall through the cracks. For example, there's the Medicaid resource limit that I don't think is going to change unless I, misheard. But what should those people do who maybe don't qualify for Medicaid because maybe their resources are too high?
Well, and correct me if I'm wrong, but under the new Medicaid regulations, they're no longer looking at the resources through the marketplace for the Medicaid. They're only looking at the income.
Okay.
Is
I
that
I
correct?
think that's
Yeah.
true.
Is that true?
Mhm, that's
Yeah.
correct.
Okay,
That's how I
great.
understand
Yeah,
it.
that's what I'm saying. There's not going to be a whole lot that really fall through the cracks anymore with this.
Okay, great. So the resource limit won't be a factor
Right.
with the Medicaid. Great. So really, we'll see coverage from 0 up to 400%
Yeah.
federal poverty lines.
Yeah.
Okay.
And to give you an idea, that 400% is really a pretty good number for a family of 4. That's right around $93,000 per year that household can earn and still qualify for some subsidies through the marketplace.
Okay. And for those families who may happen to be over that threshold, what are their options?
Well, they can still shop at the marketplace, but they're not going to qualify for any subsidies.
Okay.
Yeah, I kind of hate to sound cruel, but the government kind of assumes at that point you can afford the
to pay.
premiums, right?
Okay, so they could shop for private insurance
Yes.
outside of the marketplace. They could still shop in the marketplace.
Right, they just won't be
They
eligible
just
to take
won't
any
get the
subsidy.
subsidies.
Right.
Okay, so really, I think maybe what we're all saying at some level is that everybody can look into the marketplace.
Yeah.
And by going through that process, they'll find either a way to reach some type of health insurance, if it's Medicaid or one of these plans. So.
And what we always tell our clients that come in, you're just basically window shopping. Just come in, apply. You're not obligated to buy anything. Just come in, window shop.
So Asia, why don't you share? I think Aaron kind of talked about how people could reach him and Stacia, is that, yeah, at community health centers. How would individuals contact Helping Hands to get assistance?
Well, our facility is 4999 Northcutt Place, Dayton, Ohio 45414. And they can call us or they can just stop into our facility and we can set them up with an appointment. And our phone number is 937-268-2048. And what we do, we usually do group sessions at our facility, which are on Tuesdays and Thursdays. First session starts at 10, the second session starts at 2. And let's say you're not very comfortable with the computer, then we do one-on-one sessions with you. And at that point, we can work with you on a one-on-one basis, and we can take our time with you to help you get the insurance that is needed. And then also, we are at various local libraries within the area. And the next local library that we'll be at will be Tip City, as well as Troy and Dayton Metro Library.
You may have said this, but I wanted to clarify. What are the hours that people can call and schedule an appointment? Are they business hours, Monday through Friday? Or?
Yes, our business hours are Monday through Friday from 10 a.m. till 5. And let's say that you call after 5, you can always leave a message and someone will contact you back within 24 to 48 hours.
Okay. And how many certified navigators do you have at Helping Hands?
We have 3 certified navigators, and then we also have 1 in training as well.
Great, so you'll have a total of 4. Okay.
And we do at our facility as well. We have computers set up for individuals if they would like to do an online application. We also have paper applications for individuals, and we also have phones set up where people can call into the marketplace and set up insurance that way.
I'm going to stop for just a second because we have another caller. So, caller, you can go ahead with your question.
Yeah, my question has to do with my 23-year-old son. He is covered under my family plan under the Affordable Health Care Act, but our family plan is very expensive. Would he be better off if he applied on his own?
Aaron, would you like to take that question? Thank you, caller.
It's hard to say. The best thing to do is to look, like you said, window
Just
shop,
look.
because you can find out, what it's going to cost you before you commit to anything. So that's what I would recommend: is go to the site. You can click on the option of where you just want to look. It'll take some basic information and give you kind of a ballpark figure of what your cost would be. So then you could compare those to what you're paying right now and to see if it is going to be a better option for you.
And if it were, in this example, a 23-year-old child, adult child, their income would be counted?
The whole
Separate.
household, now the household income is going to be counted.
Okay, so let's say that if they're still living at home, for example, maybe they're a college student or something like that, if their primary residence is still with their parents, then the income will still be counted the same.
Yeah.
Is that correct? Okay. Now, if they lived somewhere else, then it would just be their income?
Yeah, unless they're, like you said, a college student where that's still their primary residence. But yeah, if they're on their own residence, then yeah, it's just going to be that household's income.
Okay, so it has more to do with the household income. Okay, great. And then I'm sorry, I know that we've had a lot of calls, but I kind of wanted to go back to, we talked about how people could come to your facilities, but I don't know that we said the dates and times. Is it Monday through Friday, normal business hours that people could contact your agency?
Yeah,
Okay.
I mean, certainly they can call in and leave us a message and we'll call them back. Again, me and Anastasia are handling 6 different centers and outreach, so we're not always at the office, but
Sure.
certainly leave us a message and we'll give you a call right back and set up an appointment. But we're there, generally 8 to 4:30, 8 to 5, Monday through Friday.
And do you do group as well as one-on-one appointments?
We do.
Okay.
That's what we've done mostly right now since there's been a lot of folks. We've been doing some things at the library where we'll do a group education. Then we'll do go around and help individuals as they go through the process.
Great. Diane? How about the Samaritan Homeless Clinic?
We also have 2 ladies,
Okay.
Kim and Carolyn, and they are available at the homeless clinic Monday through Friday, 7:30 to 4:30 on Mondays and Thursdays. They're there until 6:30 on Tuesdays and Wednesdays.
Okay.
We close a little early on Friday. We close at 2:30. But in addition to being at the homeless clinic, which, by the way, you don't have to be a patient of the clinic to come. They can help anybody who walks in off the street. So they do not have to be a homeless individual, and the clinic is very beautiful, so it's not a difficult place to walk into. And you think, oh my gosh, I don't think I want to walk in a homeless clinic, but it really is a beautiful place located by the job center. So we're really conveniently located
Right.
in that regard. But in addition to the time that we're available in the clinic site itself, we also go to the Five Rivers Health Center sites.
Okay.
That's the Family Health Center on Philadelphia, the MedSearch Health Center on Ludlow, the Center for Women's Health, which is located in Miami Valley Hospital, and the Miami Valley Dental Center, which is also in Miami Valley Hospital. So the ladies are kind of rotating between those 5 places, and also are out in the community, as Aaron and Stacia are doing, going to the libraries and different events to make themselves available and to get that information out there. Again, same as them, we'll work in groups, we'll work individually. We'll do a computer application, we'll do a paper application, and we've done some phone applications as well. So whatever really works for the individual is what we want to make happen.
Great, great. You guys use some of the same strategies, but also, have some different ones that I think helps cover everyone in our community, so that's great. It sounds like you all mentioned that there are a couple of different ways a person can apply. There's the website, right, which, Asia, you said is www.healthcare.gov?
Yes.
Right? Okay. And then there's a paper application as well as a phone application, right? What, Aaron, would you suggest in terms of, and I know that you work with all of them.
Sure.
Is one method better than the others?
Well, ideally, if you can get through the application online, that's the best way to go.
Okay.
Because you're going to see everything in real time. You're going to know what subsidies you qualify for. You'll be able to look and compare the different plans. You'll be able to plug in your subsidies into those plans, et cetera, et cetera. Unfortunately, the site's not always working nicely, so we have been required to do some paper applications and phone applications. The downside to doing that is it's kind of more of a drawn-out process because you're kind of filling out paperwork, sending it to the government's sending you paperwork back, and so it's a little more drawn out. So if you can get through the website, that's the best way to do it. The nice thing is if you create your account and you start in the application and it does freeze up on you, it's saving continuously as you go through the process. So if you get kicked out, you can go back in later through your account and pick up where you left off. You don't have to start all over again.
Okay. Do you have maybe a time comparison? If I did it on the website versus the phone versus in paper, what's the time frame we're looking at there in terms of a difference?
Well, from what I've heard, the best time is early in the morning or later in the evening is the best time to get through it on the website.
How long does it take to do it?
It's going to vary. The biggest variable is the number of dependents, because you have to put in information on everybody in that household.
Okay.
So if you've got just a single person, you might be able to get through it within an hour. Then you're going to extend that out a little bit for every dependent that you have.
Okay, great. And then if you were to do it on the paper application, you said you'd have to send in information and come back. Are we talking several weeks or?
We're guessing. I don't know.
Okay.
The process just started, so we don't have much of a return to go on at this point. But I would guess that it's going to take them. It's going to be several weeks. Yeah.
Okay. Okay. Asia, I would like to talk to you a little bit more. If a person was interested in coming to talk about insurance plans with you, what paperwork would they need to bring with them?
The paperwork that they need to bring is their social security numbers if they don't know the numbers, as well as any wage information such as their taxes or any paycheck stubs that they can bring with them.
Okay. Is one better or the other?
Well, you definitely need your wages with you as far as filling out the online application, paper application, or phone application.
Okay.
You're definitely going to need that information.
Should they bring paperwork about their medical needs?
Not about their medical needs, but at least if they have current insurance, they need to bring the policy number with them as well.
Okay.
And also we found that if you do decide to apply online, you need to be sure that you have an email address, and you need to know the password to that email as well.
Okay.
Very important.
Now, if you're using that email, does it also mean that you want to use one that you're frequently checking?
Yes.
Is that where information's being sent?
Yes.
Right.
Okay. Because I know some people who have emails but maybe don't check them regularly. So.
And they can opt, if that's the case, to be contacted through regular U.S. mail if they're more comfortable with that.
They can choose that too.
But they will need an email address in order to start up the account online. And what we can do, all of us can do, is if they don't have one, we can help create one for them on Yahoo or whatever. We'll help them do that.
Okay. And does all the information provided to you, does that remain confidential?
Absolutely.
Yes, at our facility, yes, it does.
We are, to be a certified application counsel organization, we have to enter into a contract with the federal government that essentially promises that we have been trained in HIPAA laws and confidentiality laws, that our records are not, penetrable, that you can't get into them from any other way. So, I mean, aside from the fact we're in contract with the federal government, I think that's a pretty good guarantee that we're going to take pretty good care of it.
So I don't know if we've mentioned what, Diane, is the open enrollment period for the health insurance marketplace?
The open enrollment started October 1st.
Okay.
As we all know, it's off to a little bit of a rocky start, but it is open now. And currently, open enrollment is projected to go until March 31st of 2014.
Okay.
So that at this point is what we know to be the end. Could it be extended because of the issues? Possibly, but we don't know that for certain.
Okay. And coverage will start effective when?
Coverage starts the first of the month, the first day of the month after you apply.
Okay.
So if you apply on December 14th, your insurance would start on January 1st. So as long as your application is in before the 15th of the month, you would have insurance the next month at the beginning of the month.
Okay, great. Erin, I was going to ask you, do you want to speak to at all maybe what the health insurance marketplace, how it will have an impact on healthcare coverage in our community?
Well, hopefully it'll have a major positive effect is what we're all hoping for. Certainly give the opportunity to a lot of people who have never been able to afford or have health insurance is going to offer them that opportunity to have it.
Okay, so you think that it'll increase access to health care?
I think so.
Okay. And I mean, healthcare is a pretty big industry here in the Miami Valley. So do you think that the industry is also going to grow with the establishment of the marketplace?
Oh, absolutely. And I not favor one plan over the other, but just for the Miami Valley, CareSource is a major employer here in the Valley, and they do have a plan in the marketplace. And I know that they've been expanding their employment because of that. Okay. So it's going to have a major effect just in the Dayton area because of that.
Okay. Asia, how will individuals be impacted? Do you think that they'll have or could expect a higher quality of care or better quality of life by having access to health care?
Well, definitely with the quality of care, I believe that all hospitals give excellent quality care. And as far as a better quality of life, individuals that do have the insurance, they can get the preventative care, which has been shown if you do get the preventative care, you are better off in the long run because they're able to detect any possible complications that you may have or diseases as well.
And catch it early. Do we know, and Diane, I'll ask you, are hospitals or other healthcare providers, will they also have a role in assisting people either with getting some type of health insurance through the marketplace or otherwise?
I believe a lot of the hospital systems are looking at becoming certified application organizations.
Okay.
So in healthcare in general, we play a huge role in educating consumers about good use of healthcare. One of the changes that I see that's going to be, in my opinion, one of the most effective is if I don't have health insurance today and I get sick, I go to the emergency room. I can't go to my doctor because I can't afford it. This changes the playing field. Now I can go to my doctor, which is a more cost-effective way to get my care, and stay out of the emergency room, which is the most expensive way to do it.
Yeah,
so as hospitals and healthcare organizations go, I think we have a responsibility to educate consumers about, okay, now you have these options, here's how you use them. And here's how you make this effective to make your health better. And that includes preventative care, regular care, taking care of chronic illnesses on a regular basis as opposed to just when you get sick.
Right.
Things like that.
Yeah, and having the coverage to do that.
Yeah.
So Asia, I'm curious, are the plans really affordable?
Yes, from what we've seen online, a lot of the plans are very affordable for individuals, especially the individuals that are just paying out of pocket for their health care, the ones that don't have insurance, the ones that are going to the emergency room and getting the big bills at the end after their treatment. Definitely the insurance is affordable, and especially for the individuals, if they have insurance through their employer and their employer's insurance isn't very cost effective for them. We've definitely have seen the insurance play a big part as far as helping the individuals with the insurance lowering the cost as well.
Wonderful. Well, we're almost out of time, so we'll just kind of go through, and Diane, I'll start with you. Is there anything else that maybe we haven't covered that you want to mention about the insurance marketplace or the services that Samaritan Homeless Clinic provides?
Can't really think of anything else except that, you know, we're there to help, and certainly welcome any calls, even for just general information.
Great. And Asia, anything that you'd like to add about Helping Hands' role, or anything maybe that we haven't mentioned that you think needs to be mentioned?
Well, Helping Hands ComCare is a division of Helping Hands Community Outreach Center, and some of the programs that they have there as well, besides just the Obamacare or the affordable health care, we have Save the Dream, Making Homes Affordable, which is both foreclosure prevention programs, as well as many other programs such as food and clothing assistance we can help individuals with as well.
Okay, great. So people could come to your agency with other issues as well, and you'll help them with that too. That's great. And I think that I had asked Erin this, but I'm curious too, with your appointments, how long can a person expect to be there?
It just depends, as what Aaron had stated. If you're an individual applying, it could take you maybe about 45 minutes to apply, but if you have dependents, it is going to extend the time out a lot longer.
Okay, and then I guess if they had other services they wanted to find out about as well. So, okay. And Aaron, I will ask you as well, is there anything in particular about the marketplace or what community health centers of Greater Dayton is doing in Montgomery County or the surrounding area?
The only thing I would add, and this goes for all of us, as they go through this process, just like anything through like JFS or anything like that, where they're unhappy with a decision or maybe they get denied for this or that reason, and maybe something's changed, they can file an appeal. And we're available to help them with that appeal process as well.
Okay, and thank you all so much for being here. I think we had a really interesting discussion, and thanks again. See you next time.
I picked the wrong seat because I could see what they were taping.